will doing very fine. So today we are going to see a new topic which is called as the causes of the diseases. It is the causes of the diseases. Now what we'll do is that we'll just imagine that a baby boy or a baby girl is suffering from loose motions. Just assume that a baby boy or a baby girl is suffering from loose motion. So now what we will say, like now we will have conclusions, right? We will have our own conclusions. So what will be our own conclusion? So what we will conclude? Now there are chances that we may say that the baby is suffering from loose motions because of the virus infection. Because there is an infection of the virus and all, no, that is the reason why maybe the baby is suffering from this particular virus problem. So now here the next question will be how the virus entered into the body. How it entered into the body. Maybe now we have another answer, like no, maybe she has drunk the unclean water. Okay, she has done the unclean water, or you can say the water which is completely contaminated. Okay, so now immediately the next question will be from where this unclean contaminated water come from. So how did the baby drink this contaminated water? How did this baby drink the unclean water? Okay, so now we might get a thought that this unclean water is drunk by several babies. Now only why this particular baby has got this loose motions? Why now she is suffering from the loose motions? Maybe what is the reason behind this? Maybe the reason is that the child is not that healthy. Okay, the child is not healthy. Maybe she is not that healthy. Maybe she is suffering from some kind of sickness. Okay, now the next immediate question will be why this baby is suffering from some kind of sickness. Why the baby is not that healthy? Because maybe you can give a reason that the baby is not getting the proper nourishment, that is proper food and water from the family. So now here again, if you ask this if this is a thing and all, like if you come to the poor nourishment and poor food and all, like now the next question is why she is not getting the proper food or the enough food. Okay, she is not given the proper nutritious food. Maybe or else is this only the problem, or there is some genetic disorder? Okay, is it because of the genes she is suffering from the loose motions and all? Okay, so now here again, if that is the case, the next question will be if she is suffering from the some kind of genetic issues and all, like they will cause some other problems also. But here no other problems are caused, only loose motions are caused, and so the nourishment and food is not proper here. Now why the child is not given proper food here? So the maybe they belong to a very poor family. Maybe they belong to a very poor family where they don't have the proper sanitation, proper food preparations and all, no. So they are not over there. So that is the reason why maybe their surroundings are not proper. Their surroundings are absolutely unclean. Okay, and the water which they are drinking is also not properly clean. So that is the reason why the virus might have entered because of this reason, and it entered into the baby, and that caused the loose motions. Maybe so when you talk about the disease, there are different causes, isn't it? We see here there are different causes. Why loose motions? Virus infection. Why virus infection? Unclean water. Where this unclean water has come from? Okay, several babies are drinking this water. Why all the babies are not getting the disease, and only why only this particular baby is getting this loose motions? Okay, so that's why we say that the surroundings are not clean and healthy and all, like the environment is not healthy. They are not getting the proper nourishment of food. Maybe they belong to a very poor family. Maybe there's a genetic disorder. Okay, if it's a nourishment problem, they belong to a very poor family, and that's how their sanitation, their food, and everything is absolutely not up to the mark. And only because of these reasons, what happened? The child might have developed the problem of loose motions because of the unclean conditions and all. The virus infection has taken place, and that led to the disease in the child. So this is how we can explain the causes of diseases. Causes of diseases. Okay, so now here, after this topic, we are going to see another very important topic, that is the infectious and non-infectious diseases. So children, now we come to a very important topic, that is the infectious diseases and the non-infectious diseases. Okay children, so when you come to the infectious diseases and all, like, so infectious in the sense which are which are infected, and they are infected because of the some of the microorganisms. So because of the microbes or the microorganisms, what might have happened? The infection might have taken place. For example, if you take the coronavirus, right, if it enters into the body, that will cause the infection in the body. So this infection is caused because of the microorganisms, and these microorganisms can stay everywhere. They can live around us, and they can cause, and they can contaminate our food, they can contaminate our water, they can contaminate our surroundings, and when you touch them, or when you come in contact with them, contact with the friends and all, so you might get this particular disease. So that is how, against the microorganisms are everywhere. It might be virus, it might be a bacteria, it might be a fungus, or whatever it may be. So there are chances that these may also enter into your body. So because of that infection, you can see that the diseases will develop, and those diseases are called as the infectious diseases. So it may be one single organism, or you can say it is a group of the microorganisms which are causing this kind of diseases. So here, diseases where microorganisms cause immediate sickness, or immediate causes in the body, those are called as the infectious diseases. They are called as the infectious diseases. Why they are called as infectious diseases? Because they are caused by the microorganisms. So these microorganisms are responsible for causing the diseases. Now, do you think that all the diseases which are here, which we know, are they are only caused by the microorganisms? No, they are not at all caused by the microorganisms. Like, there are many diseases which are caused by the microorganisms, by the bacteria, by the fungi. Okay, bacteria, fungi, viruses, and even protozoans and whatnot. So many organisms are there which are able to cause diseases in the human beings. So here we are talking about corona, it's caused by a virus. You're talking about some other disease, it's caused by fungus, itching sensation, and also skin irritation, skin problems, all caused by the fungi. And there are several bacterial infections also which are which are caused because of the entry of the bacteria into the body, and the people develop the disease. And also these kind of problems and all are basically caused by the entry of a microorganism into the body, and because of that the infection has got into the body of a human being, and he suffers from the particular disease and all. So now here, coming to the non-infectious diseases. Okay, these are the non-infectious. That means they are not infected from the one person to the other person. They are not transferred from the one person to the other person. So those kind of diseases are basically called as the non-infectious diseases. They are not transported, they are not transferred from the one person to the other person. Now there are several such kind of diseases which microorganisms need not give us. Right now, for example, if a person is suffering from diabetes or the blood pressure, okay, now these problems are not caused by microorganisms. This is because of the genetic disorders, or maybe because of the obesity, okay, or maybe because of the overeating of the food materials, or overeating of the food which is especially rich in the carbohydrates. So now these are not transferred from the one person to the other person. So if you come and give a shake hand to him, okay, if you just give a shake hand to him, that disease will not be transported from the one person to the other person. So it cannot be transported. It cannot be transferred from the one person to the other person, because, and that is the reason why we are calling it as a non-infectious disease. Okay, and even for example, you can take the cancer. So if a person is suffering from cancer, it is not at all transferable, right? It's not transferred from the one person to the other person. It's only because of the genetic disorders or the mutations, okay, and the sudden changes which takes place in the body and all. Because of all those things, now, like the people will suffer from the cancer. And if a person is suffering from the cancer, you cannot call it as the infectious disease, isn't it? You can only call it as the non-infectious disease, because this disease is not from a microorganism. It's not from the microorganism. So you have to keep that in your. So here the many kinds of diseases are there, like infectious are there, there are non-infectious diseases are there, and all these diseases, like they keep on spreading in the community, right? Now, if you know the symptoms, if you know how they are being spread from one person to the other person, we can control that, we can prevent that, we can even treat them also. So it's always it's like, no, it's very important to know how the disease is spreading and all. So that is what we are going to see in the next topic. And before that, we'll finish this topic with one example, right? In olden days, like there was a problem which is called as the peptic ulcers. Okay, the kind of ulcers which form in the stomach. It's a problem which is occurring in the stomach, and those ulcers are called as the peptic ulcers, or they're called as peptic ulcers. Okay, and this will result in the bleeding in the stomach. Bleeding in the stomach, that means you can see the blood in the stomach, and also acidity related pain in the stomach. So you can see the bleeding in the stomach, and as well as the acidity kind of pain in the stomach, and also in the duodenum. Now what is this duodenum? This is the esophagus, and this is the stomach, and this U-shaped part you can see here, no? This is called as the duodenum, right? So now here and also in the stomach, there used to be peptic ulcers. So because of which you can see there's a bleeding of blood in the stomach and the duodenum, and also there is some kind of acidity related pain in the stomach. So everybody thought, no, like this is because of the lifestyle of a person. It is because of the lifestyle of a person. So everybody thought that maybe because a person will have a kind of stressful life, he has a lot of stress, okay, that is the reason why these ulcers will take place, okay, and that is the reason why there is a lot of secretion of the acids in the stomach, which has led to the peptic ulcer. So people used to think that, and people used to confirm that, right? They used to come to a conclusion regarding the same. So they used to think that it's only because of lifestyle and also the stress and whatnot. So that was their intention. So, and there were two Australians, like they made a discovery about a bacterium. They discovered something about the bacterium, that is Helicobacter. The name of the bacteria is Helicobacter, and that too in the year, right, in the early 1930s and all, no, like, so Helicobacter pylori, okay, this is the name of the bacteria. So they said that this is the responsible, right, this particular bacteria is responsible for the peptic ulcers. This bacteria, which is called as the Helicobacter pylori, is actually responsible for the disease called as the peptic ulcer, a problem called as the peptic ulcer. So here Robert Warren, who was born in the year 1973, Okay, so he was a pathologist from Perth, that is also from Australia. He saw these some kind of curved structures in the stomach. He saw some kind of curved structures in the stomach which are in the form of a curve and all, and he saw that and he confirmed that they are not the normal structures, but they are the bacteria which are present in the stomach. Okay, so, and that too he noticed that in many patients, he checked many patients, and then he came to a conclusion that there are some curved parts which are present in the stomach, and all these are the bacteria which are present in the stomach. They're not the simple ones, but they are the bacteria which are present in the stomach. So he noticed that whatever the inflammation was there, so whatever the swelling was there in the stomach, there are some curved structures around that, and he confirmed that these structures are the bacteria which are called as the Helicobacter pylori bacteria. Okay, and Barry Marshall was born in the 1951 also. He was a very, very young clinical fellow. He was also very much impressed by the Robert Warren's findings about the Helicobacter pylori and all, and he also started cultivating the bacteria in the same sources. So he started extracting this bacteria, and also he started extracting the bacteria and he's cultivated them in the artificial environment. Okay, that is what we have done, and in the treatment says the Marshall and Warren, they both showed that the peptic patients, the patients who are suffering from the peptic ulcers, they can be treated and also they can be cured if all these bacteria which are in the stomach, if they are removed, then they can be easily cured of the peptic ulcer. And from then onwards, it was no longer a chronic disease. Now everybody knows peptic ulcer as a disease which is caused by some bacteria, right? It is not a confirmed disease. It's not a disease which can spread from one person to the other person. It's not a chronic disease also. Okay, and this is a kind of disease which can be easily it can be solved by using the antibiotics. If you use the antibiotics and all, the bacteria which are in the stomach will die, and definitely you will become a free person. These both, that is Marshall and Warren, they received the Nobel Prize, that too in the year 2005 for the studies on this particular bacteria. Okay, children. So this is all for today, and rest of the lesson, we'll see tomorrow. Until then, see you all. Have a great day. God bless you.